Let me welcome our guests this afternoon for our Buffalo Soldier African American Network podcast. Lieutenant Stowe, Dr. Mui, Mr. Sharma. We're glad that you're a guest with us today as well. We're glad to have you all with us, and I know it'll be a great podcast this afternoon, and it's been my pleasure to extend to Lieutenant Lowe and Dr. Mui an invitation to be with us today. Thank you so much for your preparation and your willingness to share. We're going to turn it over now to our moderator, Mr. Gary Johnson.
Hello, everybody. First of all, great afternoon. And again, like General Sandifer said, we'd like to welcome you to the Fort Bakersfield Buffalo Soldier in association with the African American Network of Kern Counties podcast. And since this is going to be the last podcast of the year, in advance, I'd like to wish everybody on the panel, as well as everyone listening, a happy holidays. Today, we're going to be talking about Vaccination Demystified. But before I go there, I'm going to introduce our podcast team. We have Major General W.A. Slade, Brigadier General Sandifer, Brigadier General C. Everly. We have our student, and this is his first time on, Ojas Sharma. He's a student at Stockdale High School, and congratulations, he's on his way to Harvard University. So big congratulations.
Hopefully.
And then last but not least, myself, I'm the moderator, Gary Johnson. Now, our two esteemed guests, I'm going to give you a little background on them. Dr. Mui, and this is Dr. Byron Mui, has worked many years in internal medicine and infectious disease. He completed his internship residency training at USC Medical Center in 1988. He's a certified diplomat of the American Board of Internal Medicine and the American Board of Infectious Disease. He's a member of the Infectious Disease Society of America and the Infectious Disease Association of California. Boy, that's a mouthful. He was in private practice until 2017 when he retired. And in 2020, he came out of retirement and joined the Centennial Medical Group in Bakersfield. Our other esteemed guest, Mrs. LaShawna Stowe. Mrs. Stowe has had a career in healthcare for 21 years. She's a licensed vocational nurse. She has worked as a supervising community health nurse, and her training has allowed her to work in urban and rural communities. She currently works at Dignity Health Care in Bakersfield in the position of Clinical Quality Liaison, LVN. She also serves with the Fort Bakersfield Buffalo Soldiers in the rank of First Lieutenant. So again, I'd like to welcome our two esteemed guests. Thank you for joining us today. So we're going to get right into it. The topic is Vaccination Demystified. There's a lot of things going on out there, and I'm dealing with this in my own family with just some of the stigma of people either deciding or not deciding to be vaccinated. COVID-19 vaccinations have been made available in the United States since about the spring of 2021. With this, there have been a lot of misgivings, misconceptions, theories given by people. Our task today has helped to provide clarity concerning the vaccine and speak to the myths and other related vaccinated, unvaccinated problems that we face. So, what are some of these myths and why should people not believe them, and what should people do? That's the first question. And I'll open that up to you, Dr. Mui.
Well, you already spoken. There's a lot of myth and misinformation out there. Now, I probably can bring up a couple of the myths and misinformation. Maybe you can later on join me and maybe ask me a few. One of the misinformation about the vaccine is they have been magnetized. No, there is no magnet in the vaccine. the vaccine technology have been developed for the past 10 to 20 years. And the group that able to break their formula to identify the know-how to generate the antibody for the spike protein from the University of Austin. And actually there's an article published by the school described about their work. So basically the vaccine are being made up of a messenger RNA, a very small genome of the virus, to teach our immune system to generate the antibody. And if you may think about the spike protein of the virus, is a very small, minute particle that hanging on the virus envelope. And for the virus to be infected the human cell or other mammal cell, they have to find a lock. And think of the spike protein as a key. And every viruses have a different lock. So for this virus, the receptor is called ACE2 inhibitor, ACE2 receptor, I'm sorry. So once your body able to capture the messenger RNA, if you do got vaccinated, your own cell will process the messenger RNA and develop into a spike protein. And that little small spike protein literally hanging out on the outside of your cell and teach your immune system to develop the antibody. So when you are next encounter, unfortunately, with the virus, your antibody will attach to the spike protein of the virus, neutralize the virus, and does not even allow the virus to find the lock. So this is how the vaccine works. No, it is not magnetized. And the second myth is the vaccine is going to be a factor in fertility. And this is also not true. And many studies, some of them are by CDC, has already showed that the pregnancy before the pandemic in 2019, in terms of the complications, and comparing with the pregnancy during the pandemic, and there is no difference. So those are the myths that I can bring up. They are totally false, and there's no facts to support it.
And Lashana, would you like to add to that?
Yes, and Dr. Mui, I'm so glad that you spoke about the mRNA, because I think one of the myths that I hear a lot is that it's going to change your DNA. And it's not going to change your DNA. It's actually working through your mRNA. As you said, it is giving your body the instructions on how to fight the virus. So the DNA is located in the nucleus and the mRNA is working on the outside. And once all of this is, once the spike protein has been created, the mRNA, all of it will be, will go away. One of the things that I find is that I hear people saying, well, I've caught COVID, so now I'm immune. I don't need to have the vaccination. And I think a lot of people don't understand that this is a virus and the virus is alive. It mutates, it changes. Every time it comes in contact with another human being, it's another mutation, because we're all different. Therefore, the virus is going to have to learn, and it is learning how to live within us and to get the things that it needs to live. So once getting COVID, being immune, I just would like for everyone to know, no, it's just like the flu. When you get the flu vaccination, it's not the same flu vaccination from last year or years past. It's changed. It changes every year because the virus changes. And so that may, I'm not going to say for sure, but that may be something that in the future would happen with COVID, considering it is a virus itself and it changes as well. So That's one of the myths. And in terms of getting the booster, I've heard a lot of people say, well, I've gotten the vaccination, I don't need to get a booster. And I think sometimes they're confusing the booster with it being another vaccine. It's not another vaccine on of itself. It's something that enhances the vaccine or the immunity that you received from the initial vaccines. I haven't seen anywhere, maybe Dr. Mui, you can speak to this. I haven't seen anywhere where they've said this is going to be a one-time only thing. This could very well be something that we'll have to get annually. We may have to get every so often. They're still trying to see that. But I would say for sure, if you've gotten the vaccine, you should really get your booster as well.
Well,
yes.
go ahead, Dr. Mui. I'm sorry. Go ahead.
No, go ahead. Yes, for the reason for the booster is because with time, your antibody will wane. So we come down to a low level that no longer will be protected the patient. And that's how they talk about the breakthrough infection. And just like anything in your body try to get rid of. And just like the nurse earlier mentioned that after you got the vaccine, the messenger RNA, it just will be dissipated in your body the next few days. And so is your antibody with times. And with time, we have more data, particularly from Pfizer. After 6 months, half of the patient getting the vaccine, we have no detectable antibody levels. That's why the CDC and the FDA recommend patient from the second shot, 6 months after the second shot, they should get a booster dose. Another reason, not just because you raise the antibody level, because each time when the virus will mutate, they become a little bit more resistant. And that's the reason everybody, if it is not vaccinated, should be vaccinated. And if you haven't got the booster dose, you should get the booster dose 6 months after your second shot.
Well, some people would say, I can get the virus being vaccinated, so why bother? What do you say to that?
Before I answer the question, I have a quote from the WHO. Getting vaccinated is a safer way for you to get the immunity against COVID-19 than getting infected and sick. The reason is when you got sick, other than you come down with the illness itself, if your illness progress become severe enough, you end up in a hospital or ICU, and there will be a smaller number of patients eventually will succumb to the illness. On top of that, now we know that 10 to 30% of the patient will develop some complication over time that you probably heard about. They call it long haul symptoms. 2 to 3 weeks after you think you recover from the illness, some of the symptoms coming back. Some patients have fatigue, some patients will have lingering cough and short of breath. Some people have difficulty concentration and memory loss, insomnia. So up to 30% of the patient having infection will have those complications. Now, the medical term now they use is called PASC. Basically, it's abbreviated for post-acute sequelae of COVID-19 infection. Now, the good thing is the NIH already organized a study through probably up to 20 research centers to enroll patients with those complications, and then study them, hopefully with understand what is the mechanism causing those long haul symptoms. And the study, I understand that it will follow up to 4 years.
So I'd like to open it up to the podcast team to ask some questions now before we go on to the next part.
I would like to answer that question you just put forward. One of the things that I wanted to say is that, as Dr. Mui had said, when you're being given the vaccine, it's creating the spike protein. You're not actually getting COVID. They're not injecting COVID into your body. So they have to look at when you get the vaccine, it's sort of like being on a basketball team. Your body is getting practice. Your body is figuring out how to fight and combat this illness that could come to them. You're not actually getting COVID. So when you actually come in contact with COVID, your body has practiced and rehearsed this for a while due to the vaccination. And now it has a starting point to fight. So you should get the vaccination in layman's terms to give your body practice to be able to fight when it actually comes in contact with COVID.
Makes sense. Any other individuals on the podcast team?
I've seen a rumor, a myth go a lot that I thought was especially false, was the vaccine itself can cause a false positive COVID test, or it can cause a real positive COVID test, but this was false according to the CDC. This is something I saw a lot on social media and in my school, so that's just one that I thought should be shared as well here.
So why do we have these wild myths? Where do they come from, and why? Do you, if you have any thought about that?
I don't know where's the myth coming from other than try to scare the public. But as I explained earlier, the way that the vaccine was produced is just a very small piece of messenger RNA. And eventually, the cell will manufacture a small protein in the cytoplasm, and not even, as the nurse stated earlier ago, not even get inside the nucleus, which is your DNA are being hosted. And so understanding the mechanism of how the vaccine are being produced, it will not affecting the fertility, either the male or the female.
May I say something here? These myths and untruths that you can find on the internet can kill you. I have a neighbor who her and her husband were unvaccinated. They had a daughter, also unvaccinated. The parents ended up with COVID. So they got treated for it. But the daughter continued to believe the rumors and untruths that she heard on the internet. Even though everyone tried to explain to her that these were not true, she refused treatment. She died. So I have a neighbor, firsthand experience, I have seen it, and what can happen when you believe those untruths. And it's just so disheartening to see that happen when there are alternatives. There's help there for you, and you ignore it. There's no rhyme or reason to it that I can see. It's just utterly ridiculous.
Well,
Okay, I have a question.
oh, go ahead.
Okay, my question is that kind of along the same line, what do you recommend as sites for the people to go to get the correct information so that they can make an intelligent decision? Are they sites that they can go to, or the agencies that they go to where they get the correct information?
Yes, I would strongly recommend, if you have internet access or a smartphone, you can go to the site, either CDC or NIH will give you the accurate information on a different subject matter. Other site that you can get in, and obviously some university, well-established university, you can also go into their website like the one that I like to follow the information and data, I use Johns Hopkins University. So there's a lot of different websites, and the bottom line is you have to find an institution is well established and to get the accurate information. And if you're not able to do that, talk to your primary care doctor, talk to your pediatrician, or locally, talk to the pharmacist if you have any question regarding the vaccine.
Okay. So that's a good segue into the next part. We want to deal with the problems. What are the potential medical and societal problems that can result from people not getting vaccinated?
Well, on the personal level, obviously that I elicited earlier ago, if you come down with the infection, you will have the long-term complications and up to 30%. Now, being unvaccinated, you have the likelihood 11 times you will get ill and end up in a hospital. And also 40 times more likelihood you can die from that infection. And that's why for right now, with the COVID surges or anybody that come with COVID infection sick enough to come to the hospital, 95% or more, they are unvaccinated. And so is the number of deaths. Right now, 95% or more that patient die from COVID infection are unvaccinated. And for the younger person, there's no question they have milder symptoms. But because it's a very infectious virus, so more people will get infected, eventually more people also will succumb to the infection. Right now, this year, the patient or the people under the age group of 18, 500 people already died from the illness. And over 5,000 children and adolescents will have the long-term complication, what we call MIS-C, multi-inflammatory symptom for children. And some of the symptoms, they also have lack of concentration, they feel tired, they have fever, they have abdominal pain. So those are the consequences on a personal level if it is not being vaccinated.
Lashana, would you like to add to that?
Yes, I agree with Dr. Mui with regard to the personal level, but I think as far as a personal level, it's also gonna, and it is impacting us as a country and as a community economically as well. Because if you're not vaccinated, there are a lot of jobs that will not allow you to work there without being vaccinated. And then there are situations where if you become ill, you're unable to go back to work. Well, that could be a large portion of our workforce, and that's going to affect all of us in the long run. We're also seeing those who do not get vaccinated or do not go to the doctor for whatever reason, a large rise in other chronic illnesses that aren't being managed due to the fears of COVID. So one of the things that I would say is think about it outside of the box. In terms of your health, your family's health, the well-being of everyone around you, but also, again, look at your economic future, because if you're not vaccinated and you're unable to get employment, or if you are not vaccinated and ill and unable to get employment, either way, it's going to be a large cost that we as a whole in this country are going to have to pay in the future, and we're starting to pay and see it now.
Okay. And I want to point this question to Ojas. In terms of high school students, what's your experience with your peers in terms of their perception of being vaccinated?
Yeah, so in high school, a lot of people are really affected by these myths that we talked about earlier. And, one of the very common myths is, oh, if I can still, and I think Dr. Mui already touched on it, why should I get vaccinated if I can get the virus anyways? And the answer was perfect. It's because it reduces your chance of hospitalization and death, even for younger populations. So that was one that was particularly perpetuated in high school and with the younger audience, and on social media, there really is no point in getting it. But that was very much false.
Okay. Now there's another major issue going on that no one really talks about: fake vaccination cards. And we're seeing professional athletes get those. Let's talk a little bit about how that impacts the problem overall. And anyone can answer that.
The athletes and the people that others are looking up to, then and it's brought around social media, then it gives people the idea to actually go out and continue this more. And when they do this, it will, impact us as a whole, again, because they're not vaccinated. As we saw, those persons ended up, at least one of them, actually having COVID. So,
Dr. Moy?
We began to see more infection now because of the holiday season. People are gathering, and this is almost like a perfect storm. So in order to avoid that, we are strongly recommend the unvaccinated do get unvaccinated, and the one that is qualified for the booster dose right now is the 18 and older. If the last dose is 6 months ago, you should get the booster dose. And I'm glad that the FDA is already approved for the younger age group from 5 to 11. That will be the age group they should get vaccinated.
Okay, great. Any other questions from the group before I move to the last subject?
Yeah, the booster dose, is it the same strength as the original 1 and 2 shots, or is it different for depending on the age of the individual?
For the Pfizer vaccine, no. The booster dose is still, Pfizer vaccine is 30 microgram. For the Moderna dose, for the booster dose is half the dose. Moderna dose for the full dose is 100 microgram. So half dose will be 50 microgram. They recommend 50 microgram because they have some data showing that the efficacy will not be affected. But if the patient got a booster dose of a half a dose, some of the reaction or the side effects will be lessened.
And what about the Johnson, which was a single dose?
Johnson & Johnson, the booster dose will be the same. And anybody got the Johnson & Johnson dose, they should be eligible 2 months after the last shot to have a booster dose. And they also recommend what they call mix and match. And they found out that if you mix the Johnson & Johnson with the messenger RNA, it can elicit much higher antibody levels, either Pfizer or Moderna. Now, if you want to be a little bit more accurate, NIH already published the data, even though it's a small number, but will give you some information to consider. If you got a Johnson & Johnson, follow up with a Johnson & Johnson booster dose, your antibody level only increased 4 times. If you got Johnson & Johnson and follow up with a Pfizer vaccine, your antibody level will go up 35 times. And then if you got a Johnson & Johnson follow up with the Moderna booster dose, your antibody will go up 76 times.
Okay, let's move to part 3.
Sorry, while we're on the topic of potential medical and societal problems, especially for African American and Hispanic Latino populations, according to the CDC, these populations are at a much higher risk for exposure to the virus and have more underlying medical conditions which amplify the effects. And on top of that, these communities are impacted by structural racism and socioeconomic factors, which also worsen the resources that they have for COVID and treatment. So, one of the best things that we can do, especially for these populations, is having podcasts like this and, talking about the myths and talking about the facts. So I just wanted to thank everybody here for doing something like this, as this is one of the best things that we can do to get past this pandemic. So thank you to everyone here.
Absolutely. Okay, we'll segue to part 3. What dangers still exist for populations because of COVID-19 and the Delta variant? And how do we live from now on? And then I also want us to talk about Omicron, because that's just recently started to come out. So if we have any information that we can speak to as that relates to the issue overall.
We don't go out as much as we used to because of the COVID virus. But when we do, we still wear a mask, even though we've had 3 shots, because we look at it as, I don't know if this individual next to me or the one in line behind me has been vaccinated. And so to protect ourselves, even though we are vaccinated, we still put on a mask. And people coming into our house, we have little booties to go for their shoes. We have masks at the door. We have sprays. We're trying to do everything we can think of to protect ourselves, our family, or individuals that we may come in contact with. And it's sad that there are people who think, oh, well, I don't have to do anything. He's probably vaccinated, so I'm okay.
I think sometimes the message is confusing, because I don't know if you've seen when I'm out and about, when you go to certain stores or restaurants, you see the signs that say, if you've been vaccinated, you don't have to wear a mask. You could if you choose, but if you haven't been vaccinated, please wear one. That's kind of confusing for some people in terms of the seriousness, I think. I think sometimes the message, it gets confusing. Do I wear it? Do I not wear it? They're going in an honor system. Is it really serious? I think that's why we might have some. We already did have issues with people wearing masks, but when you start seeing those signs in places of business, I think it also becomes confusing as well.
I know here in Kern County, we're not as strict as, say, LA County.
Yeah.
We have grandkids come up from there, and they're shocked at what they see here, individuals, when we go out to eat. Even in some cases, the waiters and waitresses aren't wearing masks. And I can see the expression on her face. I say, what's wrong? She said, they don't have a mask on. So that wouldn't happen if I was back in LA. And so, it's sad to see. And until we can get people to understand, we're trying to protect you so that you can protect your family and we can protect all.
Johnson, can I go back, touch on the topic that regarding the impact of the social if you are not vaccinated?
Absolutely.
I thought before we go to Delta, because I think it's significant, I thought maybe was brought up by you following the questions.
Yes.
The reason I try to emphasize this is in the United States, our population only account for 4 to 4% of the world population. But we have account for 15 to 18% of all the infection around the globe. And also the death tolls, we account for 15% of the death tolls around the world. As of last year, the first pandemic, we had 20 million infection. So far this year, we're coming up to 48 million, 49 millions. Now, in terms of the death, last year we have 346,000 being dead from the infection. And this year, as of yesterday, we have up to 786,000. Now, before the end of the year, I think we're going to reach 50 million infection in this country, as well as probably over 800,000 people being died from it. Why are I throwing up all these big numbers? First of all, if you think about when during the Delta virus surge start in May, we have about 2,000, 3,000 or more people died every day. Now, it come down to a little bit during the September, and now we're seeing another rise again. Even right now, we still have 1,000 to 1,500 people died a day. If I can make an analogy, if we can remember a couple of years ago when Boeing 737 MAX had 2 plane crashes, they completely halt the flight. Now we have 1,000 to 1,500 people die every day. We are talking about 2 to 3 plane crashes every day for the last 4 or 5 months, and this is abnormal. So what boils down to with this, all this infection load and also the impact of the mortality in the United States or in the Western country, United States is the first time in the past 3 to 4 decades, our life expectancy dropped 18 months. That means a lot of people being died, they do not allow to have their full potential to live. And right now, COVID is the second cause of death in the United States after coronary artery disease. Now, don't forget that all this infection and all this death can be prevented by being vaccinated. So those are the societal impact, and not just potential, it is here. And that lets me talk to another topic that I think the media hasn't been brought up much, is the healthcare workers. The first-line healthcare workers have my highest admiration. There's a journal article published from Guardian in March of 2021. They talk about 3,600 healthcare workers died from it. And as a group, the nursing staff, the nurses' aide, pays the heavier price. They account for 32%. The next group of person is the medical supportive staff like ambulance driver and the respiratory therapist. They account for 22%. The third group is the physician. They account 17%. Now, with all this healthcare professional being succumbed to the illness, now we are the third and fourth waves. They are mentally and physically exhausted. And the last time that I read, up to 20% or maybe even more nursing staff are retired and seek alternative employment. So when we have shortage of medical staff, they compromise the hospital to provide care. Like patient have heart attack or stroke or motor vehicle accident that require emergency attention because of the COVID, they overrun the hospital, the service cannot be provided. So those are the consequences on the society level. And one way we can shorten the pandemic is to get everybody vaccinated. And then they have a saying, everybody is not safe until everybody is safe. If you think about it, it's true. Because if we don't got the infection under control, each time the infection occurs in an individual will allow the virus to be mutated. And the nurse already earlier ago mentioned about the economic impacts. For me, obviously, I'm not economist, but someone common sense taught me that if a person got sick, they stay at home. But if a community or society afflicted by contagion, the society is ill. So how are you going to engage in the normal economic activities? And people are concerned about safety. They may get a second thought to go back to work. The parents are worried about their children going to school. With the congregation, particularly, some of the states do not mandate masks, which I don't agree. So those are the consequences affecting the society as a whole.
Before we close out, I want to talk about the positivity of vaccinations and the impact that it's had on the number of deaths. Do you have those numbers available? And then I'll open it up for final thoughts from the team.
What is your question again?
The question is, we've had several vaccinations. What's been the impact of folks getting sick and deaths based on increased vaccinations?
No, the current vaccines are very safe. In this country, we already have over 200 million people got vaccinated.
Mm-hmm.
And they are very safe vaccine. Around the world, over billions. Now, in this country, the majority of the vaccine are Pfizer and Moderna. Johnson & Johnson maybe account for 16, 18 million. And there's no reported any severe complications. They are very safe vaccine. Now, I can point you out that another study published by Kaiser Permanente down south in Los Angeles. In their database, they have 6.4 million people got vaccinated and about 3.6 million people unvaccinated. Now, they throw out all the COVID infection and deaths. And what they found out just comparing the vaccinated group in the 3.6 million and the unvaccinated 3.4 to 3.6 million. They found out that in the vaccinated group, they have 34% less likelihood to die from any other cause. So that tells me two things at least that I can draw the conclusion. One is the vaccine is safe, isn't it? If it is not safe, you would expect there are more people dying from the vaccination group. And secondly, for the one that is vaccinated, they probably are more take care of their health and more inclined to follow science. So those are the data and facts that support the vaccine is safe.
Right. Well, I want to open it up to the podcast team for any final thoughts before we close out.
Yeah, one of the things that I saw especially prevalent on when I was researching this was the fertility myth. And one of the reasons was there was a claim that was made that the spike protein on the coronavirus was the same protein as syncytin-1, which is involved in the growth of the placenta during pregnancy. And the thinking was that the vaccine would cause our immune system to fight against this as well, and therefore affect a woman's fertility. But Johns Hopkins Med came out and said that this is completely false. The two proteins are completely distinct. So the fertility one is absolutely false, especially in the case of syncytin-1 protein and placental growth. And a second thing that I wanted to talk about with coronavirus and the whole pandemic was mental health. You know, especially at school with the shutdowns and the activities being shut down. Depression rates have tripled over the first year of the pandemic alone. Just in 1 year, it was tripled. So I wanted to emphasize the importance of mental health and perpetuate resources for finding help. One of the ones is the Substance Abuse and Mental Health Services Administration Hotline. So that's a really important aspect of this pandemic, which I believe is not getting enough attention. So I just wanted to talk about mental health here as well.
Great, thank you. Anyone else?
Yes, I have a couple more points. First of all, currently right now, we're still dealing with the Delta virus. Over 99.5% of the sample are being sequenced, it turned out to be Delta virus. So we have to pay attention to the current situation. Now, for the last week, the Omicron that initially reported by South Africa, I think there's no question that with the data that come out right now, they are more infectious. And whether it is causing more severe illness or whether they completely evade the vaccine, I hope in the next few weeks, the scientists and the researchers can able to provide some answer. But the bottom line is our strategy handle the pandemic is still the same. Vaccination, and if you are not vaccinated, get vaccinated. If you are qualified for the booster dose, got the booster dose, and some other mitigation measure is still required. If you're indoor, make sure that you wear a mask, and so forth.
Right. Anyone else from the podcast team?
I just wanted to say that one of the myths that I hear a lot is that I've heard in the past is that the vaccine was created too quickly. Therefore, it's not good. It hasn't had enough testing done behind it. It hasn't had enough. It didn't go through the FDA. But in reality, they've actually, when you on the CDC website as well as Johns Hopkins, they've been actually working on the mRNA vaccines for the last 2 or 3 decades. And they were looking at it for Zika, they're looking at it for flu, the cytomegalovirus. So it's not that it was just created just when the former president say, hey, we need it, they did it that week. No, that's not how it worked. This is science that they have actually been working on and studying for years now. And with the need for it to be completed due to this virus that has come upon us, yes, they were able to go ahead and create the vaccine. So I think that's one of the myths that needs to be dispelled and really talked about, not only in this podcast, but everywhere else, just to let people know this is not a technology that just happened when the former president was president. This is something that they've been looking at for decades.
Right.
Yeah, I've heard this one a lot. And another thing I was hearing was the clinical trials themselves, how they were so short. But the truth is they were just overlapped. So all the steps were still occurring. Everything was there. The trials were absolutely done correctly. We just overlapped the steps as opposed to spacing them out under normal circumstances. We overlapped them. So we still got all the data we needed to ensure that this vaccine is safe and usable.
Well, again, I want to thank you guys for joining the podcast. The information here is invaluable. Dr. Moy, again, thank you for joining us. Mrs. Stowe, Lashana, thank you for joining us. And I want to leave with something, and I'll let Mr. Sandiford close this out. Vaccination is a choice, but it's clear the data says that folks that are vaccinated, basically the numbers dictate that we don't have as many deaths. And so as you're making your choice as to whether you want to be vaccinated or not, think about others more than you think of yourself. When I made the choice, what I said was, I don't want to potentially infect or impact someone else. And so I'm going to have the vaccine so that I can protect others. Those of you that choose not to be vaccinated, please use all the safety precautions and limit the number of people that you're around. You know, there was a famous comedian that said, unvaccinated people want to do vaccinated things. If you make a choice that you don't want to be vaccinated, please continue to protect others around you so that we can help to mitigate this horrible disease. And I'll end there, and Mr. Sandiford, if you want to close out, would be great.
Well, again, I just want to thank everybody for their participation today. It's been an excellent podcast on the subject that's going to be going on. And Dr. Mui, hope to see you again in the future. And Lieutenant Stowe, of course, we'll see you. And Ojas, again, we thank you for being our guest today. So thank you, everyone, and hope that you all have a good afternoon.
And happy holidays, everyone.
Happy holidays.